My fellow citizens and residents, I want to begin by thanking you for tuning in on another occasion to Leadership Matters. This is a public accountability forum where high officials of my government lay themselves open to public input and conversation regarding the big issues of the day. Certainly, there is no bigger issue than the matter of the reopening of our borders, and tonight we want to continue that particular conversation. A bit of a backdrop is perhaps important in this regard. You will recall that on March the 11th, 2020, the Director General of the World Health Organization declared COVID-19 a pandemic, which meant that it had spread to every corner of the globe. St. Kitts and Nevis, despite being one of the smallest nations in the world, was among a few countries that were able to keep the virus at bay for an extended period. This was not by accident, but the result of proactive steps taken very early by your government to protect lives and livelihoods. We called for an all-of-society approach in fighting this pandemic, and we all pulled together as one over the last 7 months and successfully contained the virus here in St. Kitts and Nevis. I have said repeatedly that in a crisis, the safety and security of my people are my primary responsibility. Therefore, we acted quickly, decisively, and deliberately in putting measures in place to shield the people of St. Kitts and Nevis from the devastating effects of a most dangerous virus. Bold, courageous actions had to be taken to prevent the loss of lives in our beloved country. We would all remember the closing of our borders, the stay-at-home regulations, and lockdowns that were all imposed early in order to contain the virus. The livelihoods of over 5,000 persons dependent on tourism and hospitality were severely affected as hotels and restaurants closed. St. Kitts and Nevis is regarded as a success story that is admired by many, regionally and internationally. To our great credit at this time, we have 0 active cases, 0 hospitalizations, and 0 deaths from COVID-19. The Centers for Disease Control and Prevention recently assessed the Federation of St. Kitts and Nevis as very low risk in its recent travel advisory, which is one of the lowest risk categories for any country. I announced on October 1st that our borders would reopen on the 31st of October 2020, and so we did. Our Chief Immigration Officer has advised that the has proceeded apace and without major adverse developments. You would recall that in advance of the reopening of our borders, we had put in place protocols and procedures to keep our frontline workers and by extension our people safe. These protocols are very stringent, with the requirement of a pre-arrival PCR testing and a 14-day quarantine or vacation-in-place experience for 14 days for arriving international passengers. While we were working on our local entry requirements, we were in discussion with our regional Caribbean neighbors to see if there was a common platform that we could use to enhance travel in the Caribbean region by way of a CARICOM travel bubble. The Caribbean Public Health Agency, CARPHA, working with CARICOM countries, put together recommendations for a CARICOM travel bubble. The regional travel bubble was intended to facilitate low-risk intra-regional travel of nationals of the Caribbean community, the movement of essential workers, and inter-regional travel of visitors to the region in an effort to revive tourism while respecting necessary health precautions. The bubble would have seen persons coming from qualifying CARICOM countries forego the mandatory 14-day quarantine period once they had a negative PCR test within 72 hours of arrival within a member state participating in the bubble. The borders of St. Kitts and Nevis were still closed on Friday, September 18th, when the CARICOM travel bubble came into effect. Accordingly, we could not participate in the initial launch of the bubble. We, however, indicated our support in principle for the concept. Since the announcement of the formation of the Caribbean bubble, we have seen a change in the risk level of a number of countries within the bubble, with Antigua and Barbuda, St. Lucia and Barbados experiencing a resurgence of new cases. We have taken note of reports about actual or potential community spread in some member states. We are concerned that the travel entry requirements are also not uniform, as requested by CARPHA, with a number of member countries having less stringent requirements than those we have put in place in St. Kitts and Nevis to keep the virus at bay. We cannot, therefore, as a nation, with a very low risk category assessment, enter a common space or bubble with countries at a higher risk level, because we would be exposing our people to elevated health risks. Similarly, it will be unwise, given our low-risk status, to participate in a bubble with others within the community, to participate in a bubble with others with community spread. If we were to do this, we will very quickly see the reintroduction of the virus and possibly the overwhelming of our healthcare system and consequential deaths. Having discussed this matter at length yesterday with the Cabinet and our National COVID-19 Task Force, and having arrived at a consensus, I have today advised the Secretary General of CARICOM, Ambassador Owen Larrock, that St. Kitts and Nevis has in our national interest, albeit for health reasons, withdrawn from the bubble effective immediately. I repeat that St. Kitts and Nevis has, in our national interest, albeit for health reasons, withdrawn from the bubble effective immediately. I have also directed our Chief Medical Officer to advise CARPHA of this decision. The Federation of St. Kitts and Nevis now requires a mandatory 14-day quarantine for all travelers from CARICOM countries, in addition to a negative PCR test 72 hours prior to arrival. The 14-day quarantine is an international best practice, taking into account the incubation period of the novel coronavirus. It is the best and safest standard, and clearly is in sync with our strategy to open up while keeping risks to our population at a very low level. In other words, entry requirements for CARICOM nationals will be the same as those for international travelers. We will, however, continue to monitor the situation and look for ways in which we can work with our CARICOM brothers and sisters going forward. This would require the establishment of common entry requirements for regional and international travelers, irrespective of countries of origin. The COVID-19 pandemic continues, to wage a war against mankind. And we will continue to do all in our power to keep our country and our people safe. All arriving passengers into our country must therefore be prepared mentally and otherwise for quarantine. Some have asked whether minors and seniors will also be quarantined, and the answer is an emphatic yes, they will be quarantined as a necessary health precaution. Accordingly, we advised that any minor traveling to St. Kitts and Nevis must be accompanied by a responsible adult. Both the minor and adult will be subject to quarantine on arrival. In a similar way, persons with disabilities who will require special assistance and care should be accompanied by a responsible adult. Today, I participated in the second ACT Accelerator Facilitation Council meeting, which discussed how the global response to secure COVID-19 tools can be accelerated. I represented the CARICOM region in my capacity as its lead head for health and related issues. There has been a significant mobilization of resources to defeat COVID-19 through equitable access to vaccine, therapeutics, diagnostics, and the strengthening of our health systems. I was heartened to learn that a portfolio of safe and efficacious vaccine can be available by March 2021 should the global community mobilize adequate resources to close the financing gap. We in St. Kitts and Nevis remain cautiously optimistic. St. Kitts and Nevis has taken proactive steps to pay in advance to secure our access to a reliable portfolio of vaccines as soon as they are available. The truth is, until we have an affordable, safe vaccine which gives prolonged immunity, the deep economic crisis caused by the pandemic will continue to scar lives, scar businesses, scar economies, and the global community. My government continues to engage all of society as we seek to chart an all-inclusive plan to restore our economy to the strong position it was before COVID-19, and thereafter to ensure that our economy is put in such good health that it can contribute to the stronger and safer future. Your government will remain focused and agile in the face of the vicissitudes of the COVID-19 pandemic. Your best interest is our primary concern. Working together, we can defeat COVID-19, and from this commitment, your government will not shirk. I thank you for paying attention to all the advisories and information with respect to COVID-19. And as we continue with our borders open to receive visitors, I trust that you will not lay down your guard. May God continue to bless the people of St. Kitts and Nevis, and may He continue to keep this beautiful country safe and free. I thank you.